Thank you for joining this lecture today. I'm going to be discussing some of the practical considerations in undertaking systematic reviews of the literature. As clinicians, it is important that we develop and refine our skills to be able to access reliable, accurate information to inform decisions on how we provide evidence-based dental care for our patients and advice to the community. As members of dental school staff, we will be starting our students on their professional journey to support them to keep up to date and evaluate developments in treatment and prevention. This lecture builds on the lecture I presented to the undergraduates, so it will be helpful if you also view that lecture. I have recorded here a summary of the slides today to make a shorter presentation, enabling a Q&A session, and the full lecture is available in PDF format. This slide summarises the main sources which I have used in this lecture. The first one on the list is from Module 3 of a new Masters in Dental Public Health at Queen Mary University of London. This is the Masters in Dental Public Health, Policy and Leadership, and it is entirely distance learning. The course lead is Dr. Vanessa Muirhead, and she will welcome any inquiries about undertaking the Masters from staff. She is working towards the programme being recognised for Commonwealth scholarships. The second source I have used is the Cochrane collaboration. They have an extensive range of training modules in systematic reviews, and you can register online for free. Of particular value is the Cochrane Handbook, which describes all the steps in undertaking a review using their methodology. The third main source, which will be useful to you as teachers, is found online at the Centre for Evidence-Based Medicine at the University of Oxford. Again, their wide range of resources are free, which you will be able to access through your university login or directly. The Bodleian Healthcare Library also provides tutorials on YouTube. Therefore, in relation to preparing teaching materials and undertaking your own reviews, do go through tutorials online. Any review of the literature begins with a clearly structured question. At the outset, questions may be simply asked and then reframed with detail to support an effective review. In this slide, I'm listing some of the simple questions we may be asking in our everyday practice. For example, the first question is this diagnostic test likely to be accurate? We might want to know what's the likelihood of accurately identifying carious lesions into dentine from a bite-to-wing radiograph, or perhaps bone loss in periodontal disease. Or you may be solicited to order a new dental material for the teaching clinic, and you can ask, is this new treatment method of benefit? How does it compare to our existing materials? Perhaps you are seeing children come into clinic with advanced dental caries, and you may be discussing with other staff whether it would be worthwhile to undertake a screening programme perhaps across the city, across Georgetown primary schools, to identify children beginning with tooth decay, rather than waiting for them to attend with advanced disease. The other questions here: how common is the condition I see in my patients? Is this the right health policy for my community? Are patients satisfied with this dental service? Essentially, what might be the best methods to use to measure satisfaction with health services? When we consider the questions that arise in developing evidence-based practice, they tend to occur in two broad areas as shown here in this slide. Our questions may be related to exposures or to interventions and the outcomes or benefits of those interventions. To answer some of these questions, I have assumed an underpinning knowledge of public health, an understanding of who is usually affected by specific dental diseases, the broad determinants of health, particularly social determinants, and the general understanding of distribution of dental diseases. However, it is worth noting that not all countries have ongoing surveys which measure disease across local or national populations. So you may not know the average dental health of children and adults in Guyana, but your knowledge may reflect your own experiences of disease prevalence from patients attending the dental centre. Therefore, you may have questions around etiology and prognosis. For example, when I'm seeing patients with diabetes, how much worse might be their periodontal health if they also smoke cigarettes? Many clinical questions relate to interventions, understanding the benefits of treatments you may be providing and the likely outcomes of interventions, whether treatment or prevention. You may have day-to-day questions around tests and screening, around best prevention techniques, primary prevention to stop disease occurring at all, secondary prevention about preventing reoccurrence for those who have experienced disease in the past, or tertiary where you have provided treatment and want to estimate likelihood of further benefit from prevention. Your questions may be outside of the clinic and relate to health policy in the local region or nationally. What would be the best ways to prevent dental diseases for people in this locality? As we consider relevant questions, we also need to specify what are relevant outcomes that are important to achieve. It may be that the main aim of a service is to relieve pain, so people can be without discomfort. It may be that their dental disease is impacting on their life, making difficulties or discomfort, for example, while eating, smiling, interacting with their family. When these difficulties that arise from their impairment or disability have additional consequences, for example, it is noticeable that front teeth are missing or broken, social consequences can occur like bullying. Then a disability becomes a handicap. The aim of our dental service may go beyond pain relief, and we want to ensure that our dental care supports people to have dentally healthy outcomes that enable them to eat comfortably, interact socially without dental difficulties. In a dental context, a mortality outcome would be tooth loss, and a morbidity outcome may be tooth decay or periodontal disease. Clearly specifying outcomes that we wish to achieve is an important component of asking clear questions when setting up effective reviews of the literature in these topic areas. As we consider evaluating treatments and health services, this slide gives examples of other areas or outcomes that we may wish to specify in our review of the literature. For example, safety. What are the potential harms of a new method or treatment? What is its efficacy and effectiveness? These two terms measure different outcomes. A new treatment may have good levels of efficacy under ideal conditions when applied by highly experienced dental teams, using materials exactly as described. But how good is this effective treatment under different clinical conditions? What happens when it is applied by less experienced clinicians like junior students? How tolerant is it, for example, to poor moisture control, less than ideal polymerizing lights? This type of measurement under real-life conditions is called effectiveness. Ultimately, the new method or material may be safe and effective, but it may be 10 times more expensive. So what is the cost effectiveness of the new treatment compared to our usual care? Other outcomes that may be important to our review question are about health services relate to equity, patient satisfaction and appropriateness. And these are also shown in this slide. So an effective treatment may not be affordable, and this would lead to unfairness in its use, or it may be ideal, but so difficult to apply in real life that the time required and discomfort is not acceptable to patients. As you can see from these slides, specifying clear outcomes you wish to measure is a critical part of refining the clinical question to be answered within your systematic review. Teaching students to spend time structuring their review questions and considering all relevant outcomes is an important element of teaching about systematic reviews. As described, conducting a systematic review that starts with a well-structured question will allow us to identify and classify the best evidence research by an analysis of published papers in a systematic format. When evidence-based medicine began, this was seen as the only measure that should be considered. However, it became clear that two other areas are important to bring into consideration once a review is completed, and these are shown in this diagram. At the top right, you can see that including opinion from clinical expertise is important. It is too simplistic to list this as the lowest level of evidence. Good clinicians get to know what works for their patients, what's possible, and clinical judgment is of value and should be considered. The third area that you cannot get from a numerical meta-analysis of clinical trials is patients' values and preferences. So we may know from a systematic review of the literature what is the best way, for example, to undertake endodontic treatment in a molar tooth, the best materials. But if patients prefer to have an extraction and don't want the expense and bother of complex endodontics, then this will become the most important consideration. Therefore, over time, it has been recognised that evidence-based medicine and evidence-based dentistry is a combination of reviewing the best research evidence available with a recognition of clinical expertise and patient preference. As we recognised in the previous lecture, the most important first step of undertaking a systematic review of the research evidence available worldwide is to have a clear question for which you wish to review evidence. As noted in the slide, a focused specific question is more likely to enable you to undertake efficient searches of databases and give you relevant answers. So you begin with a general clinical question that may have arisen in your work, and you're wondering what's the best treatment can provide in a particular circumstance. To help you structure your question, we've looked at a question format like PICO. It's most commonly used, and we know that PICO stands for P is for patient or populational problem, I for intervention, C for comparator or control, and O for outcome. In my lecture to the undergraduates, we looked at a practical example to help this process make sense. This was about the efficacy of fissure sealants, and I'll continue to use that example in this lecture. For the students, we began with the original question on the left, and through a series of slides showed them how to develop the same question using the structured PICO format. On the left, we asked, is it worthwhile to place fissure sealants for my patients? On the right, you can see the question is longer. It has added specificity to each area. I have also included in brackets more detail. Depending on the search, you may exclude these additional areas, but include them in your analysis of the papers identified. Let's read the question with and without these additional areas. First, without. Do children who have a fissure sealant placed on permanent molar teeth develop less dental caries than children who do not have a sealant? Then, with further detail, do children who have a glass ionomer fissure sealant placed on the occlusal surface of first permanent molar teeth develop less dental caries than children who do not have a sealant? For our staff lecture here, it is important to be aware that the PICO format is the simplest and most common, but that there are also some variations that can be used, and these are shown in this slide. You may decide to limit your search by looking at outcomes for a preset time after the interventions. For example, in evaluating the outcome of dental caries treatment, 2 years post-intervention would be an appropriate minimum time to judge benefit. This PICO is described as PICOT. Similarly, if you decide that you wish to only consider particular study design, this type of question or search statement would be PICOS. Most commonly, this could be only looking at randomized clinical trials. If you wish to look at one particular exposure, for example the impact of cigarette smoking, rather than all sources of tobacco, again this would mean changing your question and search term, so PICO is PECO. In this slide, I have summarised some of the main considerations needed when starting a systematic review from primary sources. How should you prepare? An important first step is that effective systematic reviews cannot be completed alone. So you would need 2 or more staff, as independent assessment should be undertaken when assessing the quality of papers. You would then come together, compare your findings. You can waste a lot of time running reviews that are incomplete if not prepared well ahead. There is a lot of free training available. Do access short free courses from trusted sources like Cochrane, PubMed, Oxford University Centre for Evidence-Based Medicine. Seek support from a medical librarian. Check in the medical faculty library. If this is a new topic for review and there are no existing reviews on this topic, you can consider registering your research question with an international group like Cochrane Oral Health. They can see if other sources exist and whether they wish to adopt your question. If so, they provide support to develop a protocol for the review. This is a very detailed process where they will come back and forth agreeing methods, search terms and so on. A new Cochrane review takes on average 2 years to complete, so it's a major undertaking and is often done as part of a PhD project. You've spent time structuring your research question and now need to develop a search plan to cover all the relevant literature. There are 4 main steps for this stage: choosing your search terms, combining those terms, and choosing which electronic sources you will include. As you go into the detailed search, you would need to specify search limits, and these could include, for example, years of publication or language of publications. We covered it in the undergraduate lecture, the common electronic sources, which could include the National Library of Medicine, searched using PubMed, Embase, Cochrane Library, and so on. As previously, this slide gives you the practical example of how to use the PICO question to form search terms. Let's think about your population. We started with your patients and decided we want to look at children. In some papers, older children could be called young people. So by adding this term to your search, you may find additional papers. To add this, you need to use the word or. Similarly, for the intervention, we stated fissure sealant. You will add papers to your search if you also include other terms for fissure sealant, like just the word sealant on its own, resin sealant, glass armour. So each time you add a search term, you will add papers to your search. As you can see, I've added other search terms for the comparative treatment and the outcome. So the first is usual care, or filling, or restoration, or amalgam. For outcome, we start with dental caries, or dental caries, or decayed teeth, or carious lesion. There may be other search terms you want to add in each category, and these are just examples. For this staff lecture, I've also added a note on 2 methods that can help with increasing accuracy of search terms, so relevant papers are not missed. One of these methods is called truncation. This allows you to include all words with slightly different endings for the same term. For example, by adding asterisk. Child asterisk will cover child, children, childhood. The second technique is setting limits to your search. For example, papers in specific languages or publications after a specified year. As we noted, after running the initial terms in your search, you will need to combine search terms. This has the opposite effect to your search. Instead of adding papers, it will reduce the total number. So reading from left to right, to be included in your search results, not only does a paper have to be about children, it needs to be about fissure sealants and usual care and dental caries, or any of the other combinations. Running the initial searches and adding in the combining terms is likely to reduce the papers you identify from many thousands to a few hundred. These have to be screened for relevance, and the first level of screening is title and abstract to ensure the paper includes the parameters you want to look at. The final stages will relate to assessing the quality of the paper and determining whether the results can be combined for numerical analysis. At the foot of this slide, I have noted websites that provide tutorials with practical illustrations for finding the evidence and conducting your reviews. This slide follows on from the earlier one about practical steps in undertaking your review. By completing the previous steps, your search will be completed and papers identified. The next step is an initial screen of title and abstract to check for relevance to your research question. It may be that you exclude some papers at this stage. It is important at each stage that you keep a record of any excluded papers. This allows a reader to check what is missing and why, and if needed, to reconstruct your search at a later date. So then they are adding just the new research papers published after your initial review. By this stage, you have the body of papers that will be retained as relevant to answer your research question. You need to move forward to evaluating the quality of these papers. Again, you need to do this in a transparent, consistent way, and there are critical appraisal tools for each type of study design that ask you to look at specific features of each paper and make quality judgments of design, results, and conclusion. In order to select the right critical appraisal tool, you need to recognize different study designs. In this slide, you can see a summary of different types of study design that the published research paper may have used. It's beyond the scope of this lecture to go through each design in detail, but it is important that you are able to recognize them by their characteristics. Let's start with the yellow box at the top of the slide, showing all primary research studies. The first step in design recognition is to decide is the paper a descriptive study or analytical study. If the paper is testing hypotheses or investigating associations between different exposures and outcomes, it has an analytical design, shown here in the green and brown boxes. Under each of these two major subheadings, descriptive and analytical, there are different types of study design are listed. For example, the blue boxes, descriptive studies, may be quantitative, looking at how often diseases occur and who has them, and these may be answered in a survey, which may count cases or diseases. Alternatively, a design may be qualitative, looking at people's views, reactions, which may have been sought through interviews or focus groups, still a descriptive study. Analytical studies, in the green and brown boxes on the right, may be observational, comparing different characteristics or exposures, for example in a case control study, or there may be intervention studies, which are experimental, evaluating new treatments, for example within a randomized control trial. The skill of appraising papers, assessing the published research evidence, takes some time to acquire, but there are very helpful tools that have been published that give you a structured step-by-step guide as to how to do this, what to look for in each section of the paper, and at the paper overall. And these are the CASP tools, developed and published by the Critical Appraisal Skills Programme. Again, they're freely available, and the CASP tools provide a structured checklist to assess different types of studies. Several are available, one for systematic reviews, for cohort studies, case control studies, diagnostic studies and qualitative studies. Therefore, it's critical to recognise the study design of the paper you're assessing. The first step is to read the whole paper and then to answer the series of questions within the CASP tool for that type of study. And on the slide, giving you the website for the CASP tools. CASP tools have 10 to 12 questions depending on the study type, and these are in 3 or 4 broad sections. Section A questions are determining whether the results of the study are valid. Section B seeks to identify whether the study is methodologically sound, and Section C assesses the results of the study. Section D assesses the question, will the results help you locally in your country, area of study, patient base? In the full lecture, consider an example of a CASP list for appraising a randomized controlled trial and reproduced each step. The first 3 questions that make Section A are screening questions about the validity of the basic study design and can be answered quickly. Question 1 is, did the study address a clearly focused question in terms of PICO structure, specific population, intervention, comparator and outcomes? The second question in Section A is whether assignment of participants to the interventions was randomised. That is, did they have an equal chance of being assigned to the test group as to the control? This reduces the chance of bias, where an investigator might choose to give one patient the intervention like a fissure sealant, rather than put that participant in the control group. Therefore, this section assesses whether that choice was made independently of the investigator. The third question is were all the participants who entered the study accounted for at the end. This is also very important. For example, if the study was conducted over 2 or 3 years, we would expect some patients not to return for assessment, to leave the area or to move away. But the essential aspect is that each one is accounted for in the report, so we know if people are missing from the final analysis and why. Questions in Section B look at methods used. For example, did the participants know which group they were being assigned to, which is being called blind to study group? Were the investigators also blind to study group? This is achieved in drug trials by giving a dummy or placebo drug, which looks and tastes the same as the test one. This may not be possible for studies comparing different dental materials. Section C examines the results, looks at how many people took part, were there enough participants, how accurate is the measurement outcomes, and did the benefits outweigh any harms or costs. This slide is the first of 6 slides which are in the main lecture, and they provide the example of the CASP tool for randomised controlled trials published by the Centre of Evidence-Based Medicine at the University of Oxford. And this looks at the first of those 6 slides, question 1A, looking at the validity of the trial and was the assignment of patients to treatments randomised. Each slide in the main lecture shows you what the question is looking for and also where to find the information and also how to rate the quality of the outcome. This slide summarises the next steps of your review. You will need to complete critical appraisal of papers using the right CASP tools for different study designs. This provides a systematic critique of each paper. Where possible, combining results of research studies. For that, you will need similar outcome measures to develop risk ratios or odds ratios and draw forest plots. An important final step is drawing up a summary of findings table. This has a standard format: PICO, outcomes, results, quality of evidence, comments. Finally, the grade approach to quality of evidence for each outcome. Grading of recommendations, assessment, development and evaluation is what GRADE stands for. It provides a measure of confidence in your findings. For example, how confident you can be in point estimates of effective intervention will depend on the quality of the studies which contribute to your summary of results. The details of how to apply GRADE can be found in the Cochrane Handbook, and there are free training modules on YouTube. Across the 2 lectures, we have considered important principles and practical steps in conducting systematic reviews of the literature, why we do them, that there are different types of studies and information that can contribute. We've spent time considering how to structure a question that will enable you to conduct a search of the literature efficiently and systematically, described primary and secondary sources of the evidence and how to access them. In the final steps, we introduce you to appraisal, assessing design, conduct and results of individual studies. Many systematic reviews are already published and have been incorporated into clinical guidelines. It is essential to use trusted resources. Finally, I'd like to thank you for your attention to this lecture, looking at practical aspects of undertaking systematic reviews. As the lecture is recorded, you can revisit any part and see the references and useful sites listed at different points in the lecture. Thank you.